today for the subject NRS 539 gastrointestinal nursing, we will be learning about peritonitis. By the end of this session, all of you will be able to define peritonitis, list the common causes of peritonitis, describe the clinical manifestation of peritonitis, identify the diagnostic tests used to confirm peritonitis, explain the medical and surgical management of peritonitis, and discuss appropriate nursing care for patients with peritonitis, and also educate patients on proper surgical wound care after laparotomy. So what is peritonitis? It is a serious inflammation of the peritoneum, which is the thin double-layered membrane that lines the abdominal cavity and covers the abdominal organs. What is the cause of peritonitis? Usually by entry of the bacteria entering the peritoneal cavity, by ruptured appendix, perforated ulcer or diverticulum, necrotic bowel, burst gallbladder, or maybe from pelvic inflammatory disease, or abdominal trauma or surgery, and also can be caused by peritoneal dialysis. The peritoneal cavity is normally sterile with only a small amount of fluid. So infection occurs when the bacteria enter the cavity. And most common bacteria include E. coli, Klebsiella, and also Pseudomonas. Okay, so these trigger the body response by sending the white blood cell to fight the infection and release the histamine to increase the vessel permeability and also produce fibrin to trap the infection. And if this is not controlled, it will lead to hypovolemia by fluid leak into the cavity and also can cause a life-threatening condition, which is septicemia. The manifestation of peritonitis may include several symptoms based or depending on the severity of the infection itself. For the local signs, the patient might have sudden severe abdominal pain that can be worsened by movement, tender abdominal, rebound tenderness, and also peritic ileus that is resulting from the peritoneal inflammation, which inhibits the peristalsis. And for the systemic signs, patients might have fever, tachycardia, tachypnea, restlessness, confusion, low urine output, and also signs of dehydration, and worse can lead to shock. As I've mentioned earlier, peritonitis can lead to serious and life-threatening complication if not treated quickly. The most common complication includes abscess formation, fibrous adhesion that can cause bowel obstruction, and also life-threatening complications such as septicemia, hypovolemic shock, and also multiple organ failure if not treated properly. There are several diagnostic tests can be done to confirm peritonitis and also to find the cause of the infection. The white blood cell count will be elevated in patients with peritonitis, suggesting infection, and blood cultures will have to be taken to check what bacteria involved in the infection. An abdominal CT scan can be used to see the peritoneal cavity. Liver and renal function studies also may be done to confirm peritonitis. In serum electrolytes, it will show increased number of immature blood cells as the bone marrow release them in response to the infection. And we can also do the paracentesis procedure to take out small amount of the fluid to see whether it contains increased protein or WBCs. While waiting for the blood cultures before knowing the specific bacteria involved in the infection, patient can be treated with common broad-spectrum antibiotics, for example, imipenem or meropenem. And after the culture results, antibiotics can be tailored to the identified organism. For the surgical management of peritonitis, laparotomy may be performed to close the perforation or to remove gangrenous bowel or inflamed appendix, and also to drain out or remove the abscess from the peritoneal cavity. And there's also peritoneal lavage, uses warm isotonic fluid to help remove the bacteria, blood, and also debris, may be continued for several days with drains in place. For postoperative care of patient returning from the surgery of laparotomy, the patient might return to ward with drain systems, and in some cases, abdomen may be left unsutured. For severe and long-standing peritonitis, the abdominal may be closed temporarily with zipper or Velcro to allow repeated exploration of the abdomen and the drainage of the infectious site. For the patient's nutrition, IV fluid and electrolyte replacement will be administered to maintain the vascular volume and also to maintain the fluid and electrolyte balance. And parenteral nutrition is given until the patient will have adequate oral intake resumes. Okay? And for other treatments, patients also will be sit on Fowler's position to help localize the infection and also to promote lung ventilation. And oxygen is often ordered to facilitate cellular metabolism and also for healing. As peritonitis is a serious illness, so it is our duty to recognize and treat the condition early to minimize the risk of the complications. So for the assessment, we have to do health history, have to take health history of the patient, the pain, the onset of the pain, the characteristic, the severity, location, and aggravating and relieving factors of the pain associated with symptoms such as anorexia, nausea, and vomiting, current and previous history of peptic ulcer disease, whether the patient have gallbladder disease, chronic disease, and what are the current medications that the patient is taking. For physical examination, vital signs including temperature, the level of consciousness of the patient, the skin color, the temperature, the warmth, capillary refill, and turgor of the skin, abdominal shape, contour, bowel sounds, the tenderness, and guarding the patient abdomen. For nursing diagnosis for patient with peritonitis, the first and the priority nursing diagnosis would be the deficient fluid volume. So in peritonitis patient, there are significant amounts of fluid loss into the abdominal cavity and the bowel, reducing the vascular volume and also the cardiac output. So the nursing intervention for these, the first one would be to maintain the accurate intake and output records. So the nurse should measure urine output every 1 to 2 hours and report the output of less than 30 ml per hour. And also to measure the gastrointestinal output at least every 4 hours. The intake and output records provide the valuable information about fluid volume status of the patient. The second intervention should be monitor the vital sign of the patient, especially the CVP, the cardiac output, and the pulmonary artery pressure every hour or as indicated. And these measurements provide important information about the fluid and vascular volumes as well as the cardiovascular status of the patient. The third one is weigh the patient daily as an indicator of fluid status of the patient. And then we need to assess the skin turgor of the patient, the color, temperature, and also the mucous membranes at least 8 hourly during every shift. Okay, so warm and dry skin with poor turgor and dry shiny mucous membrane indicate dehydration. Okay, so measure or estimate fluid losses through abdominal drains and on dressings. Next is to monitor the laboratory values, the blood result of the patient, the urine specific gravity, the serum osmolality and electrolytes, and also the ABG's result. These report changes to the result provide information about fluid and electrolyte status and acid base of the patient. Okay, so next we need to administer intravenous fluid and electrolytes as ordered to maintain balanced electrolyte of the patient. And lastly, we have to provide good skin care and frequent oral hygiene, as fluid deficit increase the risk of the skin breakdown and ulceration of the mucous membrane for the patient. Another top nursing diagnosis for the patient with peritonitis is acute pain. So in order to relieve the patient with pain, we need to assess the pain first, including the location of the pain, the severity of the pain, and also the type of the pain, and monitor the analgesic effectiveness and report the changes of the effectiveness of the pain level to the primary care provider. And second one is to place the patient on Fowler's or semi-Fowler's position to reduce the stress on the abdominal structures, which can also promote comfort. And the third one is to administer analgesics as ordered to reduce the pain level for the patient and teach the patient with adjunctive pain management, including meditation, visualization message, and progressive relaxation. Adjunctive measures can help in promoting the patient promote a sense of control over the pain for the patient with peritonitis. So before the patient discharge home, it is our responsibility as a nurse to teach the patient on the home care topics, including wound care procedures, how to do the dressing and how to do the irrigation for the wound, where to obtain the supplies, and allow the opportunities for the patient to practice and demonstrate how, or maybe not the patient, maybe the caregiver, to demonstrate and to practice the procedure prior to the discharge. And we also need to teach the patient on the prescribed medication, including what is the medication, the purpose of the medication, the name, and the potential adverse effects, and also what is the management if the patient is taking the medication. And manifestation of the further infection, we have to teach the patient to be alert of redness, heat, swelling, whether there's drainage, purulent drainage, chills, and fever. And these can be the potential complication, can lead to the potential complication, which the patient should be alert to be reported to the healthcare provider as soon as possible. Okay, and then we need to also teach the patient on the activities restriction, the any activities that the patient should do or can or cannot do, and also we have to instruct for the patient to take high calorie, high protein diet for healing process and also for optimal immune system. So these are the references that you can refer to for more information on nursing management or more information on peritonitis. So thank you for your attention and wish you all the best in your future undertakings and have a good day.